I'll never forget walking into the hospital that day. My father's cancer had spread. There was nothing they could do but give him 6 months to live and send him home to die. I remember the doctor well. He was a kind man with a difficult job. I admired my father's courage as he grappled with the news of his impending death. Years later, I met Mary Harrington.
I was diagnosed with malignant melanoma. At that point, he gave me 3 to 6 months to live.
How long was it before you started to notice changes?
I didn't die. So I knew something was happening. As a matter of fact, we were cleaning vegetables and my son turned around and said, "Mom, weren't you supposed to have..." And I said, "Been gone by now?" "Yes, but here, it's 7 months and I'm still here." 10 months on the diet, I had my first scan, and I was clear, and I've been clear since.
Mary's not alone. Every year, thousands of people reverse a wide spectrum of cancers by going outside the system to seek alternative treatments. As I researched these treatments, I couldn't help but think about my father's doctor. Why didn't he know about these? As I've come to find out, if he did know and recommended an alternative treatment for cancer, he could not only lose his license, but go to jail. This didn't make sense to me. It didn't make sense that Mary had to travel out of this country to get simple dietary treatments for cancer. Over the years, I've come to learn that when something doesn't make sense, if you follow the money, you'll usually find the answer. That's when I learned about the business of cancer. As you will soon discover, the search for a cure is hardly the altruistic endeavor you've been led to believe. In fact, it's quite the opposite. Even worse, when you look at the hard numbers, our current cancer treatments are appallingly ineffective. If you're a survivor of conventional cancer treatments, I both admire and congratulate you, because you've not only survived the disease, but the treatment. Unfortunately, you're part of a very small minority compared to the vast numbers of people who did not survive. And regardless how you may feel about conventional treatments, it's important that you watch this, because the chances cancer will return are almost certain unless you start making some big changes in your life. Over the years, there have been a lot of false claims and promises about cancer treatments from quacks, charlatans, con artists, and snake oil salesmen, all raising hopes of a cure for cancer.
These quacks, once they get to a patient, anything can happen. Proper treatment can be delayed often until it's too late.
This fake device claimed to cure cancer with tape-recorded music. The practitioner who used it was as big a phony as his device. Help stamp out quackery.
Mom, a quack is a quack, whether he comes from the South Seas or lives right here in the city. All he's interested in is taking money from people.
But when it comes to taking money from people by making false claims, no one does it better than conventional mainstream medicine. A cure is just around the corner has been the standard public relations pitch used to pump money into the cancer industry. And it was as familiar to your parents as it is to you. The medical community has been working on a cure for well over 100 years. The war on cancer was simply a massive infusion of funds, which ended up creating a bloated and ineffective medical bureaucracy. Some of those involved in the war saw this from the very beginning. "14 years after the war began, a landmark study showed that chemotherapy, the main weapon in the war, was somewhat effective for only 2 to 3% of all cancer patients, primarily those with the rarest kinds of cancer. And things have not changed since then." Here are the results of a study of every randomized, controlled clinical trial performed in the U.S. between 1990 and 2004, which reported a statistically significant increase in 5-year survival due to the use of chemotherapy. What you see are goose eggs, or near goose eggs, for all of our major cancers. This latest study simply confirmed every study that has been conducted since the war on cancer began. The highest scores, testicular and Hodgkin's, represent only 2% of all cancers, and these rates are themselves not impressive. The medical profession generally considers any drug with less than 30% effectiveness to be no better than a placebo. What you see from studies conducted over the last 50 years is that for our major cancers, the effectiveness of conventional treatments is far less than a sugar pill. One of the problems with our approach to cancer is that it's focused on the tumor. In fact, you could say conventional medicine has a tumor fetish. The appearance of a tumor is like the appearance of idiot lights in your car. They appear only after a problem has developed. So what do? We try to shrink the tumor, cut it out, or we start amputating body parts to get rid of it. Can you see anything wrong with this picture? What caused the tumor in the first place? In fact, a tumor is just a symptom of something else that has gone terribly wrong inside the body. It's simply the tip of the iceberg.
If you understand that surgery removes the tip of the iceberg, doesn't cure the cancer, have them take whatever tumor they want to take. If you then understand that they want to give you more treatment, like chemo or radiation, why? Because they couldn't get it all, and they can't remove cancer by cutting a piece.
By completely ignoring what caused the tumor, mainstream medicine leaves the fox in the henhouse, and he'll strike again. Don't you think it's strange that someone has cancer only when a tumor makes an appearance? And yet that same cancer has been growing in your body for decades? The average person gets cancer cells in their body every single day of their lives, and cancer cells are circulating throughout your body at all times. In other words, we live with cancer. And the only system capable of both detecting and destroying those cancer cells is your immune system. If your immune system is impaired and a single cancer cell escapes detection, it will set up shop and start multiplying. This chart depicts the growth of a tumor over 8 years. It starts with a single cancer cell. Most cancers will be detected when there are 4 to 10 billion cancer cells in your body. Instead of early detection, mammography and similar techniques should be called late detection. On average, the tumor is already 10 years old and has almost always spread to other parts of the body. When a tumor is detected, hospital staff try to pressure frightened patients into immediate treatment, despite the fact the tumor has been with the patient for years, sometimes decades. And with only a few exceptions, the tumor is neither health-endangering nor is it life-threatening.
The first thing people have to realize, and I deal with a lot of cancer patients, is this is a slow-growing disease. And they've got time to think about this. The problem is that the doctor puts them in a situation where they feel like they have to make the decision within hours to get the breast cut out or the prostate cut out or the colon, piece of the colon cut out. And the truth of the matter is this disease on average has been going on for 10 years before they discover it. And it'll probably go on another 10, 15, or 20 years before it kills them. So it's a very slow-growing disease, and patients should in a sense, be patient and consider all the decisions, all the possibilities, and to not panic.
In many cases, doctors will try to rush a person to make a decision right then, and they scare them by saying, we have no time to wait.
That I needed to immediately do chemotherapy, radiation, and then a bone marrow transplant. And that they were also going to do a double mastectomy just in case I ended up with breast cancer.
Many people think that chemotherapy will get rid of all the cancer cells, but even high-dose chemotherapy will not get them all. Chemotherapy works just like a pesticide. Just as there will always be a small percentage of insects that are resistant to any pesticide, there will always be cancer cells that are resistant to any combination of chemo treatments. The resistant cells will survive the treatment, reproduce again, and eventually come back with a vengeance, just like insects in the field.
The tumor becomes resistant and actually turns this chemical poison into food. Now the chemo poisons and worsens the patient. Okay, now we give you some new chemo, a different one, that the tumor has not yet developed a negative response to. Okay? And often that one still works for a little while, but then it doesn't work anymore. All it does is poison, poison. You cannot heal with poison. That's the answer. You cannot heal with poison.
This is just one reason there is such a high rate of recurrence with conventional treatments.
They've had the chemotherapy and the radiation, and for a while they thought that they were cured. They will call me and they'll say, I had this back in 2001 and I did this surgery and the chemo and the radiation, but then it came back in 2003, and I did more chemotherapy and radiation, but then it came back again, and now it's back again. What am I going to do?
Over 90% of the people that have cancer will have a cancer return. And this is what they're telling us. Do you not want to believe their statistics? I do, because I think it's over 90%.
Well, you think about it as recurrence. It's actually not recurrence at all. It's just continuation of the disease. What happens, for example, you get breast cancer in the breast, within a matter of months, say, it's spread to other parts of the body. Well, the person, the doctor cuts off the breast and concludes that the cancer is all gone, but actually it's lurking in the lungs and the bones and the brain. It's just too small to detect at that time, and it continues doubling, we call it, growing, the doubling process, and then it shows its ugly head a few months later. So it's not like it's in remission or somehow it's cured and it comes back. There's nothing that's changed. You've just dealt with, say, the breast, a local part, and there's still disease growing throughout the body, untouched by the present therapies.
There is no toxin or combination of toxins that can kill all cancer cells. Only the troops on the ground can do that. Even in those few cases where chemo is somewhat effective in the short term, It greatly raises the chances of secondary cancers and other fatal diseases in the long term. The drugs used to treat cancer are some of the most toxic substances ever designed to be used on the human body. Chemotherapy devastates the immune system so much that cancer patients have died of the common cold. If an IV bag is spilled, it's classified as a major biohazard. Yet we inject this into our bodies and expect to be cured. In survey after survey, the overwhelming majority of oncologists have stated they would never take chemotherapy if they had cancer or administer it to their families. And yet, the FDA has deemed these incredibly toxic drugs to be safe and effective, despite the fact that a common side effect is death.
There's no legitimate doctor today that will not tell you that chemotherapy and radiation destroys the body and destroys the immune system.
She went in operation on Monday. They shocked her with chemotherapy. 2 weeks later, she was dead. And they said that she had an overreaction to the chemotherapy. What the hell was that overreaction to chemotherapy? I mean, you know, people have different sensitivities to things. Why are they giving the crap in the first place? Why aren't they talking about that? But you know, she's now a patient. She's fearful. She's a very vulnerable person at this point in time. Really depressed and distressed of everything, and she's now just, she's just a pawn of the system.
Here are a few of the side effects of radiation and chemotherapy treatments. If our standard treatments are ineffective against our major cancers, why do 60% of all patients receive radiation treatments? Why do 67% get surgery? And why do 80% of all cancer patients receive chemotherapy? How can the cancer industry get away with using such ineffective treatments when the results are pathetic and in almost all cases far less than what you would expect with a sugar pill? They get away with this because, one, conventional treatments are the only game in town, And two, because there are massive sums of money at stake for the medical, pharmaceutical, and financial industries, which profit greatly from using treatments that do not work. You might be thinking, but I've read in newspapers that we're making gains against cancer. What you read is part of a phony good news campaign the cancer industry relies on for continued public funding. Here is how this campaign was described back in 1987. As a rule, the good news comes as an announcement that the 5-year survival rate for one or another form of cancer has increased. Here's a typical headline that was carried in every newspaper in the U.S. The number of cancer survivors has tripled. The chances of surviving for 5 years has soared. This gives the impression we are actually winning the war on cancer. Magically, the cancer industry has created good news from bad. Unfortunately, they're not talking about long-term survival rates, but just 5-year survival rates. In fact, the cancer industry has adopted a rather peculiar definition of a cure. Normally, a cure is defined as the elimination of a disease. In the case of cancer, a cure simply means you're still breathing 5 years after diagnosis. In fact, a cancer cure does not mean the disease has been cured at all. At the end of the 5th year, you could still have cancer, and if you're still breathing, you've been officially cured. Of course, if you die of cancer in the 6th year, you will be officially cured of cancer and dead of it at the same time. No other disease in the history of the world has had such an Alice in Wonderland definition of a cure. You can live 5 years with AIDS, yet no one will claim you're cured of AIDS. You can live 5 years with heart disease, but not a single health institution will say you've been cured of it. But if you live for 5 years with cancer, you're cured, whether you agree or not. Why then is such an absurd definition used with cancer? Because it's the only way to create the illusion we're making progress in the war against cancer.
If you had breast cancer in 1930 and you have breast cancer today, your prognosis is pretty much the same. Nothing has really changed.
Early detection is the main device the cancer industry uses to deceptively raise cure rates. When the cancer industry says that early diagnosis means you have a better chance of being cured, all they are saying is that you have a better chance of breathing another 5 years. Not because of treatments or because you're living longer, but because the diagnosis was done earlier. Suppose you have a man who died of cancer at the age of 70. If he was diagnosed at age 67, he would not be cured because he had only 3 years left in his life. But if he was diagnosed at age 64, he would have been cured because he would live for 5 years with the cancer before he died of it. Early detection makes it appear as if somehow the treatment is making people live longer, when in fact, they are not living longer. When studies have compared treated and untreated patients, they show untreated patients actually live longer than treated patients, and obviously with a higher quality of life. Most people are shocked to learn that untreated patients live as long or longer than treated ones. But what would you expect from drugs that do great harm and give benefits no better than a sugar pill?
Well, we're dealing with the major cancers like colon, breast, prostate, lung, pancreas. There's, extremely little benefit from therapy. So certainly this is a point of view that should not be dismissed, that leaving cancer untreated may result in longer survival.
Untreated patients also respond much better to natural therapies than treated patients.
We get these terminally ill patients, if they're untreated, they respond a lot better. The body hasn't been poisoned with all the chemicals, and the bone marrow and the immune system and all the defenses haven't been poisoned or destroyed.
You'll never go into conventional physician's office and have them tell you, well, listen, if you do nothing, you're actually going to live longer than if you get my treatments. They're just not going to say that. I can't tell you how many people have come in who now have a very large tumor, or it has now spread into their liver, and it was, let's say it started in their breast and now it's in their liver, and it's been 9 years, 10 years. And I said, what did you do? And they said, nothing, I just didn't want to do anything. Okay, well, that person would never have made it 9, 10 years. That person, most likely, if we look statistically at that person would have been dead probably way before 5 years. The people that refuse treatment at all come in much better condition than those that have gotten the treatment.
In other words, conventional treatments only make a bad situation worse. Thus, the cancer industry has deceptively increased short-term 5-year cure rates through early detection, but have not made the slightest dent in long-term survival rates. The one major cancer where mortality rates have fallen significantly is stomach cancer, yet early detection and treatment had nothing to do with that. It was the declining use of food preservatives and other dietary factors that led to this decline, not treatment. There are many other ways the cancer industry fools the public. Let's look at a few. Say there were 100 people involved in a clinical trial of a new chemotherapy drug. Out of the 100, you expect 2 people to get breast cancer. But during the trial, after all 100 people were put on the drug, only 1 person got breast cancer, meaning the reduction in breast cancer was 1 person out of 100. This is called the absolute benefit, 1 in 100, or 1%. This is not good news for the drug company because 1 in 100 could happen by chance. But remember, 2 people were expected to get breast cancer, and only 1 got it. And 1 divided by 2 equals a 50% reduction. Through the magic of number manipulation, this drug can all of a sudden reduce your chances of getting breast cancer by a whopping 50%. This is called the relative benefit. It magically turns the 1% absolute benefit into a 50% relative benefit. I call these rubber numbers. Of course, there are other problems. Even though this drug may have helped only 1 person, its side effects greatly raise the risk of developing secondary cancers and other diseases in all 100 people. In other words, everyone suffered harm from the drug, yet only 1 person may have been helped by the drug, and that could have been purely by chance. This was a hypothetical example. Here's one from the real world. A few years back, there were headline articles reporting a 49% decrease in the incidence of breast cancer in women who took tamoxifen for 5 years. In fact, the 49% benefit is a relative number. The absolute benefit was only 1.5%, far less than a sugar pill. Even worse, tamoxifen has many serious side effects, just one of them being liver and uterine cancer. The drug Herceptin has been described as amazing and unprecedented, a wonder drug. It's even been called a cure for breast cancer. Drug companies claimed that clinical trials showed a 46% decrease in recurring breast cancer. In fact, the absolute benefit was less than 1%. The only thing amazing about this drug was the public relations behind it. It was recently reported that a new drug produced a 23% improvement in survival for lung cancer patients. But if you look into the study, the 23% improvement translates into a survival benefit of a whopping 2 months versus those not taking the drug. Parenthetically, another 5% were expected to die as a result of the treatment itself, which was characterized as within accepted limits. Recently, headlines carried news about a new miracle cancer pill that prolonged life by 44%. Translated, that means if you take this miracle pill and endure its side effects, you may live a whopping 3 months longer.
He did offer for me to do chemo. and he said I might live, if we got the right formula, I might be able to live 3 extra more months.
I've asked them, I've asked the patient, in fact, this past weekend, what did this chemotherapy do for you? And they said, it helps me 4%. And I said, what does that mean? And they had no idea. They just kept saying 4%. And that just showed that they were trusting the doctor, but they had no idea how this was helping them, and in fact, that it wasn't helping them at all. And when I explained to them what that actually broke down to be, they were shocked.
What we have is a continuum with cancer drugs. On the left, a few might get helped. On the right, a few die. And along the entire continuum, everyone suffers severe side effects, which could result in later death. The same rubber numbers are used with mammograms. The cancer industry will cite studies showing that 20% of women who receive regular mammograms live longer. This is a total deception. That 20% death benefit was a relative number. The absolute benefit is not even worth calculating, far less than 1%. The important question is, how are the death benefits of mammograms measured in real-world terms? A woman in her 40s may gain less than 3 extra days in her life. A woman in her 50s, less than 4 days. And a woman in her 60s, less than 9 extra days in her life. And whether those few extra days are due to early detection is another wild guess, because women who get regular mammograms are healthier in the first place than those who do not. The most extensive studies on the subject show that there is no benefit of any significance from routine mammograms. In fact, 2 noted researchers recommended the withdrawal of public funding for mammograms altogether. Mammography is not a safe procedure. It does not prevent breast cancer, it doesn't cure it, it often fails to detect it, and may in fact later cause the cancer it was supposed to avoid. This was the conclusion of a recent study. Screening for breast cancer with mammography is unjustified. There is no reliable evidence that screening decreases breast cancer mortality. When doctors explain benefits in absolute terms, few women choose to get mammograms. When making a treatment decision, don't fall for rubber numbers because they'll bounce on you just like a bad check. Always ask for absolute benefits. Out of 100 people, how many will benefit? And what is that benefit in absolute terms? How many more days or months is this going to buy you?
So, you can go and look at the fact that these treatments do not work in the vast majority.